people have just reached a point where they don't know where to turn, they don't know what to do, they're confused, they're scared. There's Congress trying to reform health care. The last time it happened was in the early 90s, and that didn't work, and now they're at it again, and what's going to happen to me, and what's going to happen to my premiums, and here is the Senate Finance Committee, which is probably the most conservative committee in the Senate, taking the first crack at it. So that when I put up public options or other things of this sort, they get voted down. And so I have to understand that and live with that and then go on to the next process, which is we've been trying to get Ted Kennedy's old committee and finance committee and meld it together. And then before you get to the Senate floor where you have the big arguments. And then, and I don't mean to offend anybody here, with this very difficult situation that you face, that you start out knowing that almost half of the Senate is going to vote against you no matter what you do. Except for one wonderful lady from Maine. So I don't know, maybe you've gotten a letter from your health insurance company saying that you owe a significant amount of care. Maybe you received and you owe them some money. Maybe it says your claim is being denied because of a pre-existing condition. They've taken that to remarkable lengths, and I know people who have had their health insurance revoked because upon scrutiny by the insurance company, it was discovered that they had acne at one point in their life. So their health insurance gets revoked. That's called rescission. It's a marvelous word. It's when the health insurance company makes an agreement with you. You pay your premiums regularly. You're a faithful customer. You are sick. You need help. You need them. That's what they're in business for. But then they find out a pre-existing condition, and then they just take it away from them, which doesn't strike me as a legal thing to do. It certainly isn't a moral thing to do. It's something we have to stop. And we will stop that. We will stop that. A lot of people go out of network. They belong to some kind of plan or whatever, and they go out of network to see some other kind of doctor. In fact, 100 million Americans do that on a regular basis. Well, I won't get into it, but I'll just tell you that for those 100 million people, all of their reimbursement rates were decided wherever they live in the country, whatever health insurance company they belong to, were decided by one little group company called Ingenix, which I had never heard of. I thought it sounded like a really hot Silicon Valley, future inventor. But no, it wasn't. It was a lethal group. And they met their fate when Attorney General Cuomo in New York accused them of fraud. And their owner, United Group Health, and you've all heard of them, okay? They own them outright. And they set higher premiums. They made a specialty, and Wendell talked to us about this, of actually, which one was it? Was it WellPoint, I think, where they would pay their employees more money to find something in somebody's background which would give them a reason to cancel their health care. Or if they didn't do it, just go ahead and do it anyway. It's called purging. The facts are real. Health insurance companies are unfairly raising prices. Since 2001 or somewhere around there, their profits have risen by 400%, which is a hefty amount, a very hefty amount. And at the same time, the premiums that you're all paying have gone up by about 150%. Now, at the same time, the health insurance companies tell you they're only making 3% a year profit. And I'm trying to figure how do those things go together. And I really haven't been able to fit those two together. And I choose to believe my fear on it rather than their statement. In being for the public option, I'm not trying to punish health insurance industries. I'm not trying to vilify them. I'm trying to help people. And that's one of the reasons I'm so glad that I came to West Virginia. So now that one of the things we're talking about is doing an opt-out, not an opt-in, and no triggers. Triggers. Don't trust triggers. There was a trigger that should have been, it was part of the deal, the prescription drug benefit, which I voted against because I thought it was badly done. But at least I felt some comfort there was a trigger that if it didn't go well, then Medicare would just sort of kick in and take care of everything. Well, it didn't go well, and nobody ever pulled the trigger. Doesn't surprise me very much. But an opt-out is interesting because that means you start out with a public option. And then if you don't like it, you can get out of it, either as a matter of state legislative policy or individual decision-making or whatever. But I like that. And so if that gets put in the mark, then I think that'll be a step forward. First of all, the public option, should it become law, doesn't take effect until the year 2014. None of the health care bill takes effect until 2013 or 2014. It's a long way off. I think people will come to understand as they more understand the insurance industry, health insurance industry, they'll understand as they then become more aware of what's happening to their premiums. And then they'll start thinking more about the public option. And, you know, I think if we have this opt-out in, it doesn't compromise the public option at all. I don't think a lot of people are going to opt out, but they may, because a lot of people don't like to change, even if they're paying higher premiums, but they've got health insurance. It's human nature to sort of hold on to what you want. If you change, you really don't know if it was for real or if it was just talk.
Well, you need to have a public option to balance the expectations and demands of Wall Street. If you don't have it, you'll still just kind of perpetuate the system we've got now. It's really important to have a public option to balance the profit motive. And you have to have it for a private company. It's a requirement that they have to hand shareholder value. That has to be job number one. So you need to have a public option that gives them more of an incentive to be focused on consumer needs, not just Wall Street. So get involved and just show your support. Write letters together. There has to be some kind of expression of support that way. Otherwise, the support, the opposition from the rich and powerful special interests will appear to be winning the day. So there's enormous public support. Every poll you see indicates that the vast majority of Americans support it, even with all the negative publicity that we've seen in the insurance industry. There continues to be very, very strong support for the public option.
How much is the public plan going to cost, and will it include prescription drug coverage?
The answer to, I don't know the answer to how much it will cost. I know it will save a lot of money. It'll save $50 billion, something like that. So what it's going to cost isn't so important to me as what it will save.
No, to individuals, to us. Like per person, per family, like individual, like me, like family, like.
Well, I can't answer that, but if it's going to save overall over what our current situation is, then the odds are that it's going to help your family.
Will it be like Medicare and Medicaid, or?
No, they're very different. They're very different. And look, do prescription drugs, that's under a separate